right, good morning. We are going to review our double pumping inotropic infusions reliable method for the CCCU. Per policy, our continuous infusions are changed every 24 hours. So the first thing you need to do is request a new syringe from pharmacy and Epic messaging. This patient example is going to be on an epinephrine infusion at 1 mic per kilo per minute. It's a 25 microgram per ml syringe, and the patient weight is 10 kilos. You'll next grab a new Medfusion pump and secure it to the IV pole and plug it into the power. Once you've received your new syringe from pharmacy, you're going to follow the 7 rights to medication administration and independent double verification. You'll prime the tubing and program the pump at 50% of the current infusion rate. So in this case, that will be 0.05 mics per kilo per minute. We should have an empty port on the manifold or an empty bifuse, trifuse, or quad fuse to attach the new syringe and tubing. We are also a reminder that we're using filtered tubing in our unit.
Do you want to double verify this?
So they'll do the independent double verification and they will notify the provider that they are going to be initiating
is 1, 2, 3,
double
4, 5, 6, 7. This is epinephrine, 25 mics per ml. Weight is 10 kilos, just 0.05 mic per kilo per minute. Rate is 1.2 mLs an hour. Correct.
All right, so you may start the infusion at 0.05. Once you see an increase in your SBP by 5 millimeters of mercury, you may now decrease the old infusion to 50% of the current ordered rate, which will be 0.05, and you will increase the new infusion to the total current rate, which is 0.1. You will continue to wean off your old infusion by 0.01 mics per kilo per minute every 1 to 3 minutes, with each dose change as an independent double verification.
All right, this is Mikey Mouse, 1, 2, 3, 4, 5, 6, 7. Epinephrine, 25 mics per ml. Weight is 10 kilos, dose is 0.04 mic per kilo per minute. Rate is 0.96 mLs an hour. Correct.
You will continue to wean this until you have weaned the old infusion off.
Mikey Mouse, 1, 2, 3, 4, 5, 6, 7. Epinephrine, 25 mics per ml. Weight is 10, dose is 0.03 mic per kilo per minute. Rate is 0.72 mLs an hour. Correct.
During this process, you're monitoring your vital signs and making sure that your blood pressure is not changing by more than 5 to 10 millimeters of mercury. Once your old infusion is complete off, discard your syringe, remove it from the manifold, and make sure that you are labeling your new syringe per policy. Completing this procedure with all infusions that are infusing the same port manifold, only do 1 infusion at a time if multiple changes are required. For the purpose of this reliable method, we'll be using epinephrine, norepinephrine, dopamine, or vasopressin as a standard for double pumping in our unit.